Okay, we have three really simple exercises here that we want to do for a hip, for a sort of a hip that's a little bit flared up and sore. So this may be for an arthritic hip or post-injury. We're just looking for some things that are going to take a little bit of edge off the pain and help to maybe settle things down without really aggravating things. So what we want to do is in sitting, the first one we can try is just with the knee facing straight forward. You can lift that just a little bit, get your other foot out of the way, and just kind of allow the leg to be supported on the chair and introduce a little bit of active rotation just in the range that feels comfortable to you. If it feels better, you can hold on to the leg and give that a little bit of extra stability and support, which is kind of nice because you might even be able to get a little bit of like massaging into some of the muscles around the thigh here, and that might help things a little bit further. But it just helps to have things feeling very supported. So yeah, just a nice little range of motion, kind of swinging back and forth. I like to say, if you have any pain, we want to imagine that we're moving in the range that is completely free of pain and even maybe free of resistance. And so usually you'll have kind of a pain-free range, then a range of resistance, and then a range where it starts to become painful, and it's either like a sudden, that's painful and I can't go any further, or you can go a little bit and pain just sort of increases until you can't go further. So we don't even want to get close to that, we just want to be in that range and feel as comfy there, okay? Next one is if you're sitting a little bit more forward on the chair and just keeping the foot supported on the ground, we can come up to the toe and just kind of rocking the knee side to side. So this one is just a simple way of kind of getting a little bit of wiggling going there. And then the third exercise, and this one may or may not be comfortable for you. So this should be pain-free, all right? Maybe a 1 out of 10 is gonna be all right. If we lift that foot 1 inch off the floor and then just press, if needed, press down into it with your hand. If not needed, like if you can lift it and the moment you start to add pressure, maybe it takes your pain above a 1 out of 10, instead you can just kind of lift it or even move towards that lift and keep it partially supported. So we're looking for that no pain or pain 1 out of 10 kind of thing, just getting a little bit of activation in here. And we can do that with a deep breath. So the duration of the hold is about 1 full exhale. Like that, we might go for about 5 of those in a row. So this little circuit is something that might take you 90 seconds if you do about 30 seconds of each one. And we can do that as often as hourly or in response to pain. So if you find you're moving around, you're like, oh yeah, it's a little more sore, it's been a little bit agitated, or waking up first thing in the morning, we're looking to do something. This is a nice little routine that you can try to help take pain down in your hip. All right, hope it helps.